Hello friends, Dr. Jayshree Todkar here, laparoscopic and bariatric surgeon. Today we are going to talk about what are the effects of surgical treatment of obesity on your physical activity and whether it is a painful situation or not. Science has proven that scientifically, successfully, sustainmentwise, if you want to overcome the disease of obesity and other associated problems like diabetes, blood pressure, heart, lung, liver, kidney problems, joint problems, infertility, hypothyroidism or fatty liver or varicose veins. Above the BMI of 32.5, obesity surgery is the perfect solution to control all these problems over a long period of time. But of course, when one talks about operation, everybody gets a little bit fizzled. Is it a painful situation? Will I enter into more pains than today? And these are but obvious questions. Let's try to understand the reality about obesity surgery, pain and the physical function. The operation, which was taking almost 8 to 10 hours and 30 to 40 stitches on the abdominal wall, some 5 decades back, the situation has changed a lot. In the decade of 1990s, advancement into operational techniques with the minimally invasive or the keyhole methods, laparoscopic surgery came to us as a boon. These operations are now done with just 4 stitches on the abdominal wall. We work via the telescope looking into the camera and the TV. The operation takes around just 1 hour or less than that. Patient has to get admitted 1 day before the surgery. After surgery, in next 3 hours, patient is made to walk. Patient can go to the loo. Patient can start drinking water. And by evening, patient is up and about, self-dependent, very much comfortable and drinking clear liquids. The next day, the same things continue. We do some tests to understand whether the operation is working in the proper way, and after confirmation, we move to the next step of discharge of the patient to home. During this stay of the hospital, after surgery, within the 6 to 8 hours, many of our patients could attend the online offices, could look after their factories through their online systems. The next day, within 24 hours, patients could go driving themselves home. Patients can attend their offices and domestic all responsibilities and duties within 2 days after the operation, very safely and comfortably. Of course, we tell the patients to have 3 days of rest from the work, from admission till discharge, so that we can focus better on their health and they also can be involved positively and actively into the program. The operation once done, patients feel lighter, their sugars start coming down, blood pressure starts coming down, their energy levels are better, they feel much happier in terms of breathing pattern and the walking pattern. Once the patient is discharged, they can attend all their normal activities, of course, which are not related to the heavy load to the abdominal muscles. Within 8 days after the operation, patients are able to walk for more than an hour in a go. Patients are able to do all their pranayams and all their breathing yogas, except for that Kapalabhati, which is very heavy. Patients are able to walk on the grounds, do the cycling, go for little climbing. We start with the PT exercises for these patients from the 8th day of operation, so as to mobilize all the joints and work on all the muscles and ligaments. Within 1 month from the operation, patients are able to play on the court with badminton or tennis. They are able to do light jogging. They are able to do the light yogasanas. Within 6 weeks, we tell them that they can go ahead with swimming, trekking, cycling, all kinds of yogasanas and gymming. All these things which were not possible before operation without pain become a pain-free situation for the patient. And slowly they start understanding that they are more lighter, more fitter and more available for many of the physical activities than before. This keeps on escalating till the patient is losing weight and attains a certain stability, and patients are able to run the marathon also at the end of 6 months and ahead, even if they were not able to walk without pain before the operation. So friends, these are the operations which can give you a pain-free life, a disease which is not dependent on the painkillers, and a disease where you don't have to think twice before you put your foot ahead. If you have got any query, please let us know. You can contact us on the given numbers. Thank you.